teams, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk about specifically internal communication at the front office, because while it does start, over the phone when it comes to patient communication, our internal communication really starts whenever we're greeting those patients.
Yes, it does. So as a patient walks into the door, I always want to listen to make sure that we are re-verifying information so that I have the correct information in the back clinically. So what I am speaking of is when a patient walks in, you're saying, "Good morning, Miss Susie." As they walk up to the front, you're just going to ask simple questions. Is your phone number still in 1234? Yes. Are you still at 26 Rocky Lane? Small tidbits of information. It doesn't have to be their full address or their full phone number. And then the main thing, please re-verify their insurance. So just recap, do you still have Humana? Are you still active on Humana? A lot of times patients get new insurance and they forget to tell you. And they're like, "Oh, it's the same." Once you say the name of the insurance company, they're like, "Oh no." I do remember somebody at work saying it's now Blue Cross Blue Shield. Or they think they gave you the new address and phone number when they were in the office 6 months ago, and they did not. So when you actually say it to them and they hear it, they know at that point to go ahead and correct you. So it's just verifying all the information when they walk in to make sure we have the correct information in our system.
Yes, I love that. And that's probably where we see kind of the biggest breakdown in communication. And it's so simple, right? I would take it one step further and yes, verify the insurance information, but also make sure that you say the same employer.
Yes.
Like oftentimes people will have the same insurance company just by happenstance, but the reality is they have a whole different employer, which means even though it's Blue Cross Blue Shield or Humana, the policy has changed, right?
Policy numbers changed, group numbers changed, member IDs changed, every bit of it's changed.
And so, starting there, building that connection, building that rapport with, the patient walking in the door and then going through all of that information. And here's the hard part. Even when you just saw them a week ago, which is really irritating, right? Because it's like, I just saw them a week ago. I'm sure it's fine. But guys, people are busy and life happens and people change jobs and insurances change, right? And so it's just double checking and verifying, because people, as we know, patients hate surprise bills, right? To be fair, we all hate surprise bills.
I don't think anybody likes surprise bills.
And sometimes they get surprise bills because we didn't do the front end part. So that's where it starts.
It does. It starts there. And you mentioned a good thing. If we saw them a week ago, the other thing we need to verify is their date of birth. So what happens is if a patient comes in and they are 17 and they have now had a birthday and they're not 18, they are so lucky because they get to refill out their new patient packet, even though they're an established patient, because they're now 18. So they actually legally have to sign the forms themselves. I always tell everybody up front, though, to please direct them. They're 18. It's probably the first time they've ever had to do this, and they don't know what they're doing. A lot of parents sometimes forget to educate their children on filling out any kind of information at a medical facility. So you just need to guide them, help them understand what they need to put on there. You legally can't tell them, but you can guide them. And the main part is on their emergency contacts.
I was waiting for it, ma'am. I was like, okay, make sure. Yes, I'm so with
Emergency contacts. It's so important. I understand the insurance is under dad, and maybe mom sent their child with their credit card. So they want to call and ask about a procedure and what was billed that day. If the child forgot, and I keep saying child, but now they're an adult, forgot to list their parents on their contacts or who we're allowed to speak with for HIPAA, we can't talk to them. Even if it is their insurance or it is their American Express that they paid for, it doesn't matter. They gave the child, or the adult, the responsibility of handing them their card to pay for their treatment that day, but they're not on their packet, so now we can't speak to them about anything. So the way that I always handle this is I always look at the patient and I ask them, who would you like, if there's an emergency listed, would you like your parents? And I just kind of subtly nod my head yes, and they're like, yes, I want my parents. They don't think about those things. So it's just help guiding them and educating them on what the actual information they're writing down is for.
Love that. Awesome. So that's probably the biggest breakdown that we see in offices. So guys, as you're implementing this in your practice, don't forget to build that rapport with the patient right when they walk in, but have that checklist, have even a cheat sheet that sits up on your computer. And it's like, okay, name, birthday, address, employer, insurance. And the faster you get and the more you role play it, the faster you'll get, and it will just become your natural language that you use every single day. But as always, if you need help, reach out to us. Otherwise, we can't wait to see you and serve you soon.